I'd now like to call, with great pleasure, student observer Noah Danesh to speak to all of us. Noah, welcome. We're glad you're part of us and look forward to hearing your words.
Thank you, Chair Lansing, and thank you to the whole committee. I'm really honored to have this opportunity to share a student perspective to the committee and kind of bring in some of my experiences to apply to what we've been discussing. As Chair Lansing said, I'm Noah Danesh. I'm a student here at UCLA. I'm majoring in psychology and pursuing a path in medicine. And I've had the opportunity to see the UC health system not just as a student, but also by volunteering at the Ronald Reagan Medical Center. So I've had the opportunity to see both sides. I wanted to start with highlighting some takeaways I had from this annual report. The discussion right now addressed many of my points, but just some highlights. I wanted to first say how great it is that we are now recruiting a director of student health and well-being. I believe that having a point person for such an important student-centered issue will help us successfully meet the unique needs of 285,000 UC students. I also appreciate the focus that Dr. Byington has on expanding the collaboration between UC Health and the student health centers to provide the best service for the students. On the note of collaboration, I'm glad to see that the leadership of the academic medical centers are making student mental health issues one of their top priorities. And what was particularly interesting to me from this report was that whole telehealth role in mental health services. Currently, Live Health Online is available at some of the campuses, and it has high usage with high satisfaction. So I think that points to some of the potential that we have in telehealth throughout the university system. And UC Telehealth, I think, would be a great conduit between UC Health and student health centers by providing some counseling and psychiatry services from the UC Health centers. It may not have to be on the same campus, thus opening a much greater pool of specialists for the students. And I want to stress how important I believe it is for UC Telehealth to find the necessary funding to develop one strong, unified system instead of the confusion that we may have among different services. A student might not be willing to find out, which is the best way to find it if they have so many options. So developing one UC telehealth solution for mental health, I think, is the best way to go forward. I spoke to a few students about their experiences with counseling and psychological services, and they told me there were two main barriers that made them more apprehensive to seeking care. One of them was finding the right time in their hectic schedule to make it to the office. I think obviously telemedicine provides the flexibility so that students won't need to sacrifice academics to seek the correct care. The second barrier was the wait time between initial screening and being seen by a specialist. The report mentions that it's 11 days for counseling appointments and about 12 days for psychiatry. And while these numbers are going down, I believe that we have the potential to improve those. Increased use of telemedicine will definitely help bring that number down by reducing the burden for some of the on-campus health centers. And in addition to that, as Regent Park was mentioning, there's a lot of unmet need on campuses. There's 30 vacancies for on-campus counselors in the UC system. On top of that, there's 27 more positions needed to reach the 1 to 1,000 counselor to student ratio. Filling these roles and decreasing the disparity among different campuses can help us address the wait times for the growing UC population. And now my last comment on this topic is funding for mental health. I won't go in too deeply today, but back in August 2019, there was the report that estimated funding needs for the 3 tiers of mental health services through 2025 would be about $176 million. In this year's report, there was a request for an additional $5.3 million. So in order to reach our goals of mental health services through telehealth and filling these vacancies and having the preventative care, I think we need to close that gap and make sure we are planning budgets with adequate requests for allocations for our mental health services. So that's my main comments for H6. I had a brief comment for discussion H7, which is coming up. I believe that UC Davis's new vision with community collaboration is what really helps the UC system provide such a positive patient experience. And I think that an emphasis on these new partnerships should be on proactive care. So working with cities and community organizations to identify and proactively treat at-risk populations can help to lead to a better allocation of resources and improve patient outcomes. And I think we should be looking at implementing a similar model as UC Davis to the health centers across the UC system while fine-tuning it to reflect each unique community. So that concludes my remarks for today. I just want to say thank you again to Chair Lansing and to the committee for all the work they do for the students. Thank you very much.
Well, thank you for being here, for your very intelligent and thoughtful remarks, and we look forward to working with you.
Thank you very much.
Thank you.